In this video, Dr. Furze will share with you what you need to know about ultrastructure rhinoplasty and revision rhinoplasty, what it is, the benefits, and how to prepare for surgery.
Hi, I'm Dr. Furze, and I'm here to help you understand rhinoplasty, revision rhinoplasty, and our unique approach that we call ultrastructure rhinoplasty. When I perform these surgeries, I am dedicated to improving your nasal form and function so that you can breathe better, look better, and live better. I firmly believe that each patient deserves to have a nose that functions normally and fits within the unique characteristics of their face. I take a comprehensive approach to address all areas of the nose, which leads to better and more permanent surgical outcomes. I will work closely with you to understand your goals and create a plan to accomplish the desired results. My ultrastructure rhinoplasty procedure is designed to change the outward appearance of the nose for either cosmetic or functional purposes. I created this technique to provide a more constructive surgery with results that can last a lifetime. This technique can be used in all forms of rhinoplasty, whether or not you have previously had nasal surgery. My comprehensive preservation rhinoplasty procedure focuses on preserving and strengthening all parts of the nose. My technique can be used in both primary and revision rhinoplasty. My no-rib revision rhinoplasty technique focuses on harvesting non-structural bone from inside the nose. This allows me to rebuild the nose where other surgeons would use rib cartilage. My ultrastructure revision rhinoplasty is performed on patients who have previously had rhinoplasty procedures. A patient may need revision rhinoplasty if they are not satisfied with their previous surgery or if they have suffered significant change to their nose since surgery. There are many ways a rhinoplasty can improve your appearance, including resizing or narrowing your nose, refining or lifting your tip, improving your projection, reshaping your nostrils, minimizing or eliminating a bump, fixing a crooked, broken, or asymmetrical nose. Your first visit will be a telemedicine appointment where we will get to know each other. We will discuss your aesthetic concerns and any functional nasal issues you may have. We'll also discuss your medical and surgical history. You will visit our office for your second appointment. We will take a CT scan of your face, nose, and sinuses using our in-house CT scanner. This will allow us to diagnose any nasal obstructions, sinus, or facial abnormalities. We will also take high-definition before photos. Your third appointment will be held via telemedicine so that we can show you your CT images and computer-generated photos of your projected aesthetic outcome. We will also walk you through your potential surgery. Your fourth appointment will be a pre-op visit in our office. A final nasal evaluation will be conducted to confirm the CT findings, and we will review your surgical plan once more. We will also order prescriptions for post-operative pain medications and any needed antibiotics. To ensure positive long-term outcomes for my patients, I assess each person's unique situation to determine the best course of action to meet their functional needs and/or aesthetic goals. With my unique surgical techniques, you gain many benefits over traditional rhinoplasty surgeries. Your results should last a lifetime compared to traditional rhinoplasty, where the nose can change form over the 1 to 2 decades following the procedure. My techniques help avoid issues such as nasal collapse, breathing obstructions, and weakening of the nasal structure. Your tests typically need to be done 30 days before surgery. 2 weeks prior to surgery, stop taking ibuprofen and aspirin-based medicines to avoid unnecessary bleeding or complications. Only take supplements that I have approved. If you are on blood thinners, we may have to communicate with your primary care doctor for a plan to discontinue them. Begin sleeping face up a week or 2 before your procedure. You cannot drive after receiving anesthesia. Wear clothing that is easy to take on and off, such as a button-up shirt, so that you do not have to slip anything over your nose and face. Your surgery will be performed under general anesthesia at an accredited surgical facility in Orange County. Typically, rhinoplasty surgeries are performed in 3 to 5 hours, although it could take longer to address functional breathing issues inside your nose. On the day of surgery, you will check into your assigned surgery center. At that time, you may be required to pay any copays or coinsurance if there is an insurance as well as a cosmetic charge for the aesthetic portion of the surgery. The nurse will review your medical history, such as any medication allergies, and will start your IV. I will visit you and answer any of your last-minute questions. Our anesthesiologist will speak with you and begin the anesthetic process by giving you some pre-operative medications. Your anesthesiologist will escort you to the operating room and to the recovery room when your surgery is finished. During your recovery time, your nurse will make sure you are doing well, remove your IV, and help you get dressed. Since rhinoplasty surgery is done on an outpatient basis, you will return home after recovery. You will not be able to drive after surgery. We will call your driver with an estimated pickup time for you. The cast will hold your nose in place while you heal. Internal silicone splints will also be placed inside of your nose. Do not attempt to remove any of these items as they are integral to a successful outcome. I will begin removing them at your 1-week post-operative appointment. I'd like to thank you for your interest in our practice. If you have any nasal, sinus, rhinoplasty, or other facial plastic surgery concerns, please give us a call today so that we can help you breathe better, look better, and live better.